Dr. Auerbach, we go to do a cleaning every, 6 months, and some of us need one more often, and you explain some of it. You can touch on it again, but, cleaning and periodontal disease treatment are slightly the same thing, just have a different magnitude. And there's another thing called the deep scale cleaning in between. When a normal cleaning doesn't do the trick, then a kind of a deep scale cleaning comes in. And then if that isn't enough anymore, a full-blown laser surgery, which these days isn't so much bloody anymore, as you explained. It has it's done with laser and it's basically very smooth. But there seem to be those three different, really actually four different, because if you before the cleaning, you need to do the brushing and the flossing. So there are 4 ways of taking care so that you don't get a gum disease. By doing so, don't poison your body and eventually don't lose teeth. Explain each one of them a little bit, please, just so we get an understanding, especially the one with the cleaning and the deep scale cleaning. Because patients sometimes, they arrive at the doctor and a cleaning is a lot less expensive than a deep scale cleaning and all that, and they go, oh, what do you mean? So go and tell us about it.
Sure. It's not like a black and white line. There is a little bit of a gray in between everything. So basically, a regular cleaning would be a situation where you're very well taking care of things. You're keeping things pretty good, maybe missing a little spot here or there, but not much bleeding. The pockets where the gum and the tooth are connected are shallow, which means you can get in them at home with your toothbrush or your floss and keep them fairly clean. So that's a healthy situation, is a normal cleaning. Now, if you start to have more bleeding or you're not doing a good job and there's a lot of plaque or tartar on your teeth, then you may need a little deeper cleaning. Depends on how deep the pockets are. What happens when your body gets an inflammation, the infection, the blood is rushing to the gums and swelling. That takes place and displaces the bone. The bone actually gets worn away, and now you have less support for the tooth. And we want to stop that procedure, stop that from happening any further. So we may, we'll prescribe the deeper cleaning, which means we'll maybe anesthetize, get the area numb so we can get down into those deeper pockets with our instruments and clean them out and get rid of the plaque, get rid of the tartar, get rid of just the bacteria that are in there, flush them out with, different antimicrobial rinses, things like that get in there, maybe even placing little antibiotics in there to help clean those areas so that it can get healthier and get more pink and not as red and swollen. So those would be your deep cleanings whenever you have that. Now, if there is only so much that, so far we can get, if it's below 5-6 millimeters, we don't have any direct visual sight into that pocket, so we can't see that we're getting onto the root surface where it may be dipped in or curved. Most roots aren't just a nice smooth curve. There's a little depression here or there. So maybe something we can't get to. At that point, then now the laser, which has its laser energy, will go in there and kill the bacteria, smooth the root surface by hitting that laser energy. Since it's a beam, it can get to all those surfaces without having to have the instrument flush against it. We can wipe that light across there, that laser, and do that cleaning. So that's when we would need to go into a more involved procedure.
Got it.
Does that answer your question?
I think it does. So basically, when it comes to a normal cleaning, usually no injection, no anesthesia is needed. You just, you kind of scrape things off and that's kind of it, right?
Right. Almost like a little polishing.
Yeah.
Like then polishing the surface.
A deep scale cleaning might need already some numbing otherwise, because you're digging in and scraping in deeper, but you're still doing it with physical instruments. Am I correct there?
Right. And just like everybody's pain threshold is different, some people may need to get numb, some may not. So it just depends on the person and how sensitive the teeth are.
Got it. And then the next one would be when the pockets, basically the deepness of how deep this inflammation has gone in needs to be handled in your office with a laser, and then you kind of can clean it out all and all that type of stuff, right?
Right. So it's the depth of it, and also if there's an area that maybe it's not responding well to the deep cleaning, then we can use the laser in those areas as well. Also in areas where there's been more bone loss, even if the pockets aren't deep, maybe we want to try to basically grow the bone and the gum tissue back to how it used to be, and the lasers now are able to do that. So there's a couple of scenarios where we'd want to use the laser.
All right. So basically, it's not, as you said, black and white. So maybe your whole mouth might need just a normal cleaning, just to give an example. But there may be that one area, that one tooth in the back or somewhere, which actually needs a little bit of a laser treatment.
That's correct. Every person is different, so we customize all of our treatment to each person's needs.
But the purpose of all of them, including the cleaning and brushing at home, is to keep the gums and the bones infection-free.
That is correct.
Well, all right.
Yeah, we want to keep it healthy.
Yeah. Okay. Thank you very much, Dr. Auerbach.
It's my pleasure.